Did you know there's a vegetable sitting in your refrigerator right now that could be quietly pushing your creatinine levels up in less than a week? And here's the thing. Most men I talk to have no idea. They're eating it because they think it's healthy. They've been told it's healthy. But for aging kidneys, that healthy vegetable can become a slow-burning problem that doesn't show up until the damage is already done. I'm Dr. Noah Prescott. I've been practicing internal medicine and nephrology for over 30 years, and I've seen this pattern play out hundreds of times in my clinic right here in the United States. A guy comes in, mid-60s, maybe early 70s. He's been watching his diet, doing what he thinks is right, but his lab numbers are creeping up. His creatinine is elevated, his potassium is too high. And when we start going through what he's been eating almost every single time, we find at least one or two vegetables on that avoid list that he's been loading up on. That's exactly what today is about. I'm going to walk you through 4 vegetables that are genuinely good for your kidneys. Vegetables that can help reduce inflammation, lower the burden on those filters working hard inside your body, and support your blood pressure at the same time. And then, I'm going to show you the 4 vegetables you need to back off from, especially if your creatinine is elevated, if you've been told your kidneys are underperforming, or if you're managing high blood pressure alongside kidney issues. Before we dive in, I want to address something real quick. A lot of you watching this are dealing with a double situation. You've got high blood pressure and kidney concerns at the same time. That's extremely common in men over 60 in this country. In fact, hypertension is one of the leading causes of kidney disease in American men. So throughout this video, I'll be flagging how each vegetable affects not just your kidneys, but your blood pressure too. Because you deserve information that fits your actual situation, not just a generic list. All right, let's start with the good stuff. The first vegetable I want to talk about is zucchini. Now I know what some of you are thinking. Zucchini? Doc, that sounds like something my wife puts in a casserole. And yeah, maybe it does. But hear me out, because this humble little vegetable is one of the most underrated foods for men with kidney concerns. Here's what makes zucchini special. It's not just about what it contains, it's about what it doesn't contain. Zucchini is naturally low in potassium, low in phosphorus, and has a high water content. For kidneys that are already working overtime, that combination is like giving a tired worker a lighter load. Your kidneys don't have to strain to filter out excess minerals that they can no longer efficiently remove. In my years of practice, I've had patients come back after 2 or 3 weeks of incorporating more zucchini into their meals and tell me they feel less heavy, less bloated, less of that dull pressure in their lower back. Now, kidney disease doesn't cause back pain the way people sometimes assume, but the inflammation reduction is real. Zucchini contains antioxidants, including lutein and zeaxanthin, that help reduce oxidative stress in the capillary walls of the kidneys. And here's something most people don't know. In men over 60, those capillary walls often become fragile due to years of elevated blood pressure or accumulated toxins in the system. Antioxidant-rich foods help reinforce them. How should you eat it? Don't overthink this. Slice it up, toss it in a skillet with a little olive oil, maybe some garlic, not too much salt, and you're good. You can also spiralize it if you want something that feels like pasta without the phosphorus load. The key is to cook it lightly. Overcooking zucchini destroys a lot of the beneficial compounds. A light sauté or roasting in the oven at moderate heat preserves the nutrients without losing the texture. The second vegetable every man with kidney concerns should be eating is red bell pepper. And I say this with confidence because the science behind red bell pepper and kidney health is genuinely impressive. Here's the deal. Red bell pepper is packed with vitamin C, vitamin B6, folic acid, and fiber, yet it's remarkably low in potassium compared to most vegetables. That matters enormously when your kidneys can no longer efficiently regulate potassium levels in your blood. High potassium, a condition called hyperkalemia, can lead to serious heart rhythm problems. In men who are already managing blood pressure issues, this is not something to play around with. But the real standout in red bell pepper is a compound called capsanthin. This is the natural pigment responsible for that deep red color, and it has measurable anti-inflammatory properties. Think about what inflammation does inside your body. It strains the small blood vessels. It taxes the filtration membranes in your kidneys. It contributes to the very conditions that make kidney disease worse over time. Capsanthin works against that process. I tell my patients to think of each piece of red bell pepper as a natural defense capsule. You're getting antioxidant protection, you're keeping potassium intake reasonable, and you're feeding your cardiovascular system at the same time. And since so many of you are managing high blood pressure alongside kidney concerns, that cardiovascular benefit is not just a bonus, it's essential. Best way to eat red bell pepper: roast it in the oven or sauté it lightly with extra virgin olive oil. This actually concentrates the antioxidants rather than diminishing them. You can throw it in eggs in the morning, mix it into a grain bowl for lunch, add it to any protein at dinner. It's one of the most versatile vegetables out there, and for men watching their kidney numbers, it should be a staple. Now, third on our list is cabbage, plain old cabbage. And I know it doesn't sound exciting, but cabbage has been a cornerstone of therapeutic diets for kidney patients for decades, and there's a solid reason for that. Cabbage is low in potassium, low in sodium naturally, and it contains compounds called glucosinolates that have been studied for their role in reducing oxidative damage. For the aging male body, particularly for guys who spent decades eating the standard American diet, maybe with some heavy red meat, processed food, not enough hydration, the kidneys have accumulated a significant inflammatory burden. Cabbage helps start clearing some of that. There's also a practical reason I love recommending cabbage. It's cheap, it's widely available at every grocery store in this country from here to rural Montana, and it's easy to prepare in multiple ways. You can eat it raw in a slaw, steam it as a side dish, use it in soups, stuff it, ferment it into sauerkraut, which adds the bonus of probiotic benefits for gut health. A healthy gut actually reduces the metabolic waste your kidneys have to process. That's a downstream benefit most people don't connect. For men who are also dealing with high blood pressure, cabbage is high in vitamin K and vitamin C, both of which support vascular health. That's a 2-for-1 that I genuinely appreciate in a single food. The fourth vegetable on our yes list is cauliflower. Now, cauliflower has had its moment in the spotlight over the past few years. Cauliflower rice, cauliflower pizza crust, cauliflower everything. And yeah, some of that trend is hype. But from a kidney health standpoint, cauliflower deserves the attention. Cauliflower is low in potassium and phosphorus, the two minerals that healthy kidneys regulate but damaged kidneys struggle to handle. It's also rich in vitamin C and folate, and it contains indoles, which are compounds that help the liver neutralize toxins before they even reach the kidneys. Think of cauliflower as helping your kidneys by reducing the workload before it even starts. In clinical nutrition, we sometimes talk about upstream versus downstream interventions. Cauliflower is an upstream food. It helps your body process and neutralize waste earlier in the chain, so your kidneys aren't the only defense. For men with early to moderate kidney disease, this kind of dietary support can genuinely slow the progression. One quick practical tip: if you're doing cauliflower rice as a substitute for white rice, you're also significantly reducing your phosphorus intake compared to regular grain. That's a meaningful swap for anyone managing kidney function. All right, now we get to the other side of the list. And I want to be clear, I'm not saying these vegetables are bad for everyone. I'm saying that for men dealing with kidney disease, elevated creatinine, or high blood pressure affecting the kidneys, these 4 vegetables need to be approached with real caution. The first one is spinach, and I know this one is going to surprise some of you. Spinach has been marketed as one of the healthiest foods on the planet. Popeye, green smoothies, the whole thing. And for healthy kidneys, spinach is fine. But here's the problem. Spinach is extremely high in oxalates. Oxalates are compounds that, when processed by compromised kidneys, can accumulate and form crystals, kidney stones. For men, kidney stones are already more common than in women. If you're over 60 with reduced kidney function, adding large amounts of spinach to your diet is like giving a clogged drain more material to trap. Spinach is also high in potassium. 1 cup of cooked spinach contains around 840 milligrams of potassium. Compare that to red bell pepper, which has about 210 milligrams per cup. For kidneys that can't regulate potassium effectively, that's a massive difference. Now, does this mean you can never touch spinach again? Not necessarily. Some of my patients can tolerate small amounts of cooked spinach, and I want to emphasize cooked, because boiling spinach actually leaches out a significant portion of its potassium and oxalates into the cooking water. If you drain and discard that water, you've reduced the risk considerably. But if you're throwing raw spinach into smoothies every morning thinking you're doing your kidneys a favor, that needs to stop. The second vegetable to limit is Swiss chard. Similar story to spinach. High oxalates, high potassium, and a lot of my patients are shocked when I tell them this because Swiss chard looks like just another leafy green. But the numbers don't lie, and the question I get constantly is, "Doc, does this mean Swiss chard is completely off the table?" And my answer is, for men with significant kidney disease or elevated potassium levels, yes, it largely should be avoided. For men with mild kidney concerns, small amounts prepared the right way, boiled and drained, can sometimes be managed. But it's not a daily staple. Third on the avoid list is tomato. Now, I can hear half of you pushing back already. Because yeah, tomatoes have lycopene, which is great for prostate health, heart health, and cancer prevention, and that's all true. I get it. Guys ask me all the time, "Doc, but lycopene is good for the heart, isn't it?" And yes, for a healthy man with no kidney concerns, tomatoes are an excellent food. But here's the reality for men with kidney disease. Tomatoes are high in potassium and phosphorus, and they're often consumed in concentrated forms. Tomato sauce, tomato paste, tomato juice, where the potassium content is dramatically amplified. A quarter cup of tomato paste has roughly 3 to 4 times the potassium of a fresh tomato. If you're putting that on pasta, in chili, in soups, multiple times a week, it adds up fast. Does this mean you need to eliminate tomatoes entirely? For some men, yes. For others with milder kidney involvement, a small amount of fresh tomato, not concentrated, occasionally in the diet can be managed. But you have to be honest with yourself about how much you're actually consuming. Most guys I see are eating way more tomato than they realize between pasta dishes, Mexican food, pizza, and condiments. The fourth vegetable on the caution list is potatoes. And this one matters especially because the number one question I get from men managing both kidney issues and blood pressure is, "Can I still eat potatoes?" And I understand why. Potatoes are an American staple. Baked potato, mashed potato, French fries, they're in everything. Potatoes are high in potassium. A single medium-baked potato with skin has around 900 milligrams of potassium. That's significant for kidneys that are struggling to regulate this mineral. High potassium, as I mentioned, puts stress on the heart, which then compounds the cardiovascular burden that's already elevated in men with hypertension. However, and this is important, there is a technique called leaching that can significantly reduce the potassium content of potatoes. You peel them, cut them into small cubes, soak them in cold water for at least 4 hours or overnight, then boil them in fresh water and drain. Studies suggest this process can reduce potassium content by up to 50%. It's not a perfect fix, but it means that for men who genuinely struggle to give up potatoes, there's a way to enjoy them more safely in moderate amounts. Now, I want to spend a moment on something that doesn't get talked about enough in videos like this, and that's the combination problem. A lot of men I see are managing both hypertension and kidney disease simultaneously. And the dietary guidance for these two conditions overlaps significantly, but isn't identical. High blood pressure management often focuses on reducing sodium and increasing potassium, so doctors will tell you to eat more bananas, more leafy greens. But if your kidneys can't handle potassium, now you've got a conflict. This is exactly why generic health advice can be frustrating and sometimes dangerous. What works for your neighbor who's managing blood pressure with no kidney involvement may be completely wrong for you. I've had patients come into my office who were following heart-healthy diet advice from their cardiologist while inadvertently damaging their kidneys because no one had connected the two conditions in their dietary planning. My recommendation: if you are dealing with both conditions, ask your doctor for a referral to a renal dietitian, a nutritionist who specializes specifically in kidney health. They can build you a personalized meal plan that threads the needle between both conditions. In the meantime, the vegetables I've recommended today, zucchini, red bell pepper, cabbage, and cauliflower, are generally safe and beneficial for both kidney health and blood pressure management. That's not an accident. I chose these specifically because they work for the dual condition situation that so many of you are in. I also want to touch on hydration because this is another area where I see men over 60 make consistent mistakes. Most guys in this age group are mildly chronically dehydrated. They don't feel thirsty the way they did at 30. The thirst mechanism naturally dulls with age, but your kidneys need adequate fluid to flush out metabolic waste, to prevent the concentration of oxalates and other minerals that form kidney stones, and to maintain the filtration pressure that keeps creatinine levels in check. My general guidance, unless you have been specifically told by your doctor to limit fluid intake due to fluid retention or heart failure, is to aim for around 6 to 8 cups of water a day. Not soda, not coffee as your primary fluid, not sports drinks loaded with potassium and sodium. Water, plain water. Herbal teas without added sodium are also fine. Some of my patients find it easier to keep a simple 32-ounce bottle on their desk or counter and just make sure they fill it twice a day. That's it. Simple. Now let me give you a practical sample of what a kidney-friendly day of eating actually looks like for a man in his 60s or 70s dealing with these concerns. Because I know a lot of you aren't just looking for a list, you want to know what to actually put on your plate. In the morning, something like scrambled eggs with sautéed red bell pepper and a handful of fresh herbs. A piece of white bread or white toast, not whole wheat, which is higher in phosphorus, with a little unsalted butter. Coffee is generally fine in moderate amounts for kidney health, though I'd avoid adding high potassium creamers. For lunch, think about a bowl of cauliflower rice, topped with grilled chicken or white fish, not dark meat chicken, which is higher in phosphorus, with sliced cucumber, a little lemon juice and olive oil, some iceberg or romaine lettuce. Light, clean, low potassium, low phosphorus, high protein that your kidneys can handle. Dinner could be baked white fish with roasted zucchini and cabbage lightly sautéed in olive oil with garlic. A small portion of the white rice or white pasta on the side. Again, white over whole grain here, because for kidney patients, the phosphorus reduction matters more than the fiber benefit. Between meals, if you need a snack, apples are generally safe, as are blueberries, which also have significant antioxidant benefits for kidney tissue. Crackers with unsalted butter, a small handful of macadamia nuts, lower in potassium than most other nuts. Notice what I didn't put in that day. No spinach smoothie, no tomato sauce, no baked potato, no Swiss chard salad. These aren't the foods that support your kidneys. They're the ones loading them down. I want to close with something I've told patients for 3 decades. Your kidneys don't ask for attention. They don't send you a warning signal the way your heart does when you climb stairs too fast or the way your joints remind you when the weather changes. They just quietly do their job, filtering about 200 liters of blood every single day, until one day they can't do it as well anymore. By the time you notice something is wrong, the swelling, the fatigue, the elevated numbers on your lab work, the damage is already in progress. But here's the good news. I've seen men in their late 60s and early 70s stabilize their creatinine levels, slow the progression of kidney disease, and genuinely improve their quality of life through consistent, targeted dietary changes. Not magic supplements, not expensive treatments, just eating the right things and avoiding the wrong ones consistently over time. The 4 vegetables I told you about today, zucchini, red bell pepper, cabbage, and cauliflower, are not complicated foods. You can find all of them at your local grocery store, whether you're in a big city or a small town. They're affordable, they're versatile, and they work with your kidneys instead of against them. The 4 you need to watch, spinach, Swiss chard, tomatoes in concentrated forms, and high potassium potatoes, aren't off limits forever for everyone, but they need to be approached thoughtfully and with awareness of what they're doing inside your body. Take this information, have a real conversation with your doctor or your nephrologist about your specific numbers, and start making the adjustments that fit your situation. How many of the vegetables I mentioned today are already part of your regular diet, the good ones or the ones to avoid? Think about that honestly, because the answer to that question might have more to do with your kidney health than anything else you've done this week.